Hi everyone, my name is Robin Perry. I'm from Dalhousie University, and today I'll be presenting some preliminary evidence of CBD expectancy effects on subjective anxiety and sedation in healthy adults. So cannabidiol, or CBD, is the second most abundant constituent in the cannabis plant and is purported to have a number of therapeutic benefits, including sedative and anxiolytic effects. Has been growing interest in using CBD as a treatment for stress and anxiety-related disorders. And despite emerging evidence suggesting that CBD may have some anxiolytic and stress relieving effects, it's unclear to what extent these effects are due to pharmacological factors, non-pharmacological factors such as expectancy effects, or some combination thereof. Now, a recent study by our group found that CBD expectancy alone was sufficient to cause increased feelings of sedation, as well as changes in physiological responses that are relevant to its anxiolytic effects. CBD expectancy also reduced subjective ratings of anxiety following an acute stressor, but only among participants who held pre-existing beliefs that CBD is helpful for anxiety relief. Now, in this study, expectancy-related findings may have been limited due to potential ceiling effects caused by the high intensity of the stressor that was used to evoke a stress response. So the stress and anxiety response was so strong that might have limited their ability to detect expectancy-related influences. Now, it is really important to understand the role of expectancy effects in CBD's therapeutic potential. This would not only have important methodological implications, highlighting the need to control for expectancy effects in research on CBD, but also has important clinical implications for the treatment of stress and anxiety-related disorders, considering that CBD is being widely used sort of for those purposes. So in this study, our goal was to determine the extent to which CBD expectancy alters subjective stress, anxiety, and sedation in healthy adults following a mild psychosocial stressor. Also note that another aim of this research was to test or validate a modified stress task that could be implemented in a neuroimaging context to look at the effects of CBD expectancy on anxiety and stress-related responses in the brain. So this was a pilot study in that respect, and some of the features of this protocol were designed for that purpose. So in the methods section here, you can see a timeline of our experimental protocol. So we had 31 healthy adults complete a single experimental session where they self-administered a CBD-free hemp seed oil sublingually, so they held it under their tongue for 60 seconds. Half of the participants were told that the oil contained CBD, and the other half were told that it was a CBD-free hemp seed oil. An independent blinder administered the oil to the participants so that the experimenter would be blind to the expectancy condition. And participants received the oil in packaging that corresponded with their assigned expectancy condition. So even though everybody received the CBD-free hemp seed oil, those in the told CBD condition received the oil in a CBD bottle, and those in the told CBD-free condition received the oil in a hemp seed oil bottle. After taking the oil, participants were told that the effects of CBD can emerge in the body and brain within 10 minutes of sublingual administration, and then they completed a 10-minute sham absorption period. After oil self-administration, participants completed a 4-minute stress task, which was a modified version of the Trier social stress test. So they performed mental math and received negative evaluative feedback from the experimenter. So throughout the task, they were repeatedly prompted for faster performance, and then if they made a mistake, they had to start again. Participants were also informed that they would be erroneously informed that they'd be completing 2 trials of the task, and that the second trial would be more difficult than the first. And we did that to minimize confounding effects of any relief associated with the task being over on that post-stressor rating of stress and anxiety. And also just to see if the stress and anxiety response would be sustained for what would be the duration of a functional brain scan in our next study. Subjective stress, anxiety, and sedation was assessed using a numerical rating scale from 1 to 10, and we measured the subjective effects at baseline, 10 minutes after oil intake, immediately after the stressor, and after a 10-minute anticipation period, so at 4 different time points. At the end of the session, they were asked to report which type of oil they had received, and this served as a manipulation check just to ensure that their beliefs corresponded with their assigned expectancy condition. In terms of our sample characteristics, we did have a young adult sample with a mean age of 20.2 years, 64.5% were female, and the sample was predominantly white. Now, to be included in the study, participants had to be free of any psychiatric or mental health conditions. So this was a healthy community-based sample, so no anxiety disorders. And we measured trait levels of anxiety using the state trait anxiety inventory and stress using the perceived stress scale just to test for any group differences in sort of trait levels of anxiety or stress. Participants in this sample had relatively modest patterns of cannabis use, and 87% of the sample was cannabis oil naive. We also measured their beliefs about the stress and anxiety relieving effects of CBD on a scale from 1 to 10. And as you can see, participants in this sample did believe that CBD reduces both stress and anxiety. Importantly, there were no significant differences between the two expectancy conditions on any of these measures. Data was analyzed using linear mixed models, and we did control for individual differences by including baseline ratings of sedation, stress, and anxiety as fixed time-varying covariates in our analyses. So what did we find? In terms of sedation, as you can see in Figure 1, CBD expectancy was associated with increased sedation across all time points while controlling for baseline levels. So participants reported feeling more sedated after being told that they had received CBD, which is consistent with previous findings and suggests that expectancy plays a role in CBD's perceived sedative or calming effects. In terms of anxiety and stress, there was a significant main effect of time for both anxiety and stress, with significant increases from pre to post stressors, so from time 2 to time 3. Which suggests that the modified stress task was successful at inducing subtle changes in subjective stress and anxiety. No significant main effect of expectancy or expectancy by time interactions were detected for subjective ratings of anxiety or stress. However, when we look at the pairwise comparisons for the expect by time interaction, we do see comparable increases in anxiety from post-oil to post-stressor in both conditions, as well as a significant reduction in anxiety from post-stressor to post-anticipation period. So this is all in Figure 2. However, the magnitude of decrease from post-stressor to post-anticipation was greater, almost double, in the told CBD condition relative to the told CBD-free condition, which you can see in Figure 2. This suggests that participants who believed they received CBD recovered more quickly following the stress task and were less anxious in anticipation of a second trial of the stressor. For stress, as you can see in Figure 3, we see some similar changes in subjective ratings of stress in both expectancy conditions for all 4 time points. Although, as you can see, stress ratings are slightly lower in the told CBD condition relative to the told CBD-free condition, but this wasn't statistically significant. So while we're not necessarily seeing the hypothesized effect of CBD expectancy on anxiety and stress specifically, these preliminary findings do suggest that CBD expectancy alone may be sufficient to alter subjective responses relevant to its anxiolytic properties. Although data collection is ongoing, so the magnitude of these effects remains to be determined. Now, these findings should be considered in light of some limitations. So at this point, data collection is ongoing, but we do have a relatively small sample size at this point and low statistical power. So we are underpowered to also kind of look at that moderating effect of CBD beliefs, which we will do once we have our final sample. It's also a healthy and relatively homogeneous sample, so we may have limited generalizability. And then kind of in the opposite direction of our previous protocol, CBD expectancy findings may have been washed out by potential floor effects related to stress and anxiety. So there were some cases where participants reported experiencing no stress or anxiety at all across all 4 time points, so rating 1s across the board. And with a small sample, this could really impact results. So once we have our final sample, we may consider running the analyses with and without those cases just to see if there are any differences that are observed. Finally, our final subjective assessment was taken when participants were still anticipating a second trial of the task, and therefore were lacking a true recovery point. Now, in terms of future directions, we plan to replicate this protocol with a neuroimaging component to evaluate the effects of CBD expectancy on stress and anxiety-related neural responses. And it will be important for future research to evaluate CBD expectancy by pharmacology interactions using a full balanced placebo design where CBD is actually administered. So thanks everyone for listening, and I hope you enjoy the conference.